So, you're probably here because perhaps it's allergy season. Are you having watery eyes, stuffy nose, or are you sneezing often? Well, today I want to go over with you some complementary and alternative therapies I found in my evidence-based research. My name is Cassie and I've been a registered nurse for approximately 12 years. I recently graduated with my nurse practitioner license, which means I've studied Western medicine for many years. And today I'm here to share my knowledge with you and to take you along a journey with me to dive deep into alternative and complementary medication or therapies from the West all the way to the East of the world. Today's topic of choice is Spirulina. It is a blue and green algae. It was used by the NASA during their space mission, and it was found as a food source all the way back in time, dating back to the Aztecs. It is known for its anti-inflammatory and immunity properties. It does not have significant side effects according to research. It holds up to 70% of protein. It has essential vitamins like vitamin B12, vitamin A, essential minerals like iron, and you'll see later on how it's helped a lot of people with anemia or those that have low blood levels. And it's really good for the stomach because it has no cell wall, meaning the body can easily digest it and utilize all of its nutrients. Also, the FDA has actually labeled it as a safe product to consume. So back to what I mentioned earlier, you're here today because you're having symptoms of what you would call in medical terminology, allergic rhinitis. What is allergic rhinitis? It's pretty much like your seasonal allergies. So are you having sneezing, nasal congestion, where you're talking like this, and you can't breathe, clear and watery discharge coming from your nose, and you're always wiping your nose, or you're getting tissue and you're always having to pull it out of your pants pocket and wipe your nose because it just keeps running? Or is your nose just really itchy all the time, where you're just having to do that and touch your nose because you're just feeling like you need to itch your nose? So you would call this an IgE mediated response. What is an IgE mediated response? Well, our body has what you call immunoglobulins. These immunoglobulins help the body protect itself against foreign invaders. Now, there's 5 types of immunoglobulins. You have type M, G, A, E, and D. So let's just go over a brief summary of how your body protects you from any type of foreign invader. So let's say that all of a sudden you go to a field of grass and you see little beautiful yellow poppies, but you know that you shouldn't be there because these poppies, they cause you an allergic reaction. But it's so beautiful and you want to be there and you want to take some Instagram photos, or you just want to capture the moment with your family and friends, and you just want to remember the moment. But at the same time, your body is sneezing and coughing and your nose is itching and your eyes are watery. Well, the body's first response is through immunoglobulin M. So this immunoglobulin M, also known as IgM, it responds to the pollens from the poppies right away. It's the first responder. This is how healthcare providers can tell if you recently been infected by something and your body is just responding to it. So if the IgM levels are high, it means that you just had the infection and your body is just responding. Then over time, the IgM levels drop down, and the second responder is IgG, immunoglobulin G. The immunoglobulin G is like a friend that's watching you get into a fight, and then he sees that, okay, you're not doing so well, so let me intervene and assist you. So the IgG will be the second responder. And they found that IgG is the only immunoglobulin that crosses the placenta. So those mothers out there, you're wondering, how does your baby protect itself from infections? Well, IgG is the immunoglobulin that's found most in your baby. There's an abundance of IgG when you take the blood sample from your baby during the birth. Then you have your other immunoglobulins, which is IgA. Now, IgA is found in a lot of your body secretions, like your saliva, your tears, your intestine, your genital tract, where you go pee, and your respiratory secretions. So the IgA helps protect the mucus lining of all of these 5 areas from being under attack and degrading the mucus lining, which protects foreign bodies from entering and damaging those areas. IgD protects the body from foreign invaders that may be attacking your white blood cells. And what are your white blood cells? Your white blood cells are really good at killing viruses and killing tumor cells. And again, the fifth one is your IgE. This one here, the IgE, is what gives you the allergic reactions, the congestion that you experience, and it helps protect the body from parasites. So a lot of the times, if you have intermittent allergic rhinitis, meaning it comes occasionally throughout the week or throughout the month, or if you have seasonal allergic rhinitis, like it comes typically during the spring or the fall, it runs in the family. Perhaps asthma runs in your family, and you're more likely to get allergic rhinitis if you have a family member with asthma. So people who get intermittent allergic rhinitis, like sometimes throughout the week or throughout the months, it's usually caused from pollens, animal dander, the flooring and upholstery like carpet and curtains that can hold a lot of dust, mold, humidity, perfumes, and tobacco smoke. When you come into our office, we immediately know or assume that you have allergic rhinitis based off of your symptoms. So usually we see that you're always clearing your throat. You're doing frequent nose sniffing, like you're breathing with your mouth because your nose is congested, meaning you don't close your mouth very often to breathe, so slightly open all the time. Or you have a crease right here in your nose because you're always itching your nose and trying to relieve the itchiness. Or you have what they call allergic shiners, which means that you have dark circles under your eyes, right along here. And also, that nose crease is typically seen more often in children. So after you have the initial symptoms, after you've been exposed to something that's causing you this allergic reaction, approximately like 4 to 6 hours after, your body is continuously responding to these foreign bodies. And what happens in your nose is that the tissues start to swell. And because the tissues start to swell, it means your body's response is drawing in fluid to that area and drawing in other immunoglobulins to that area to help protect you, and is making it very swollen. So that's why about 4 to 6 hours after you have those initial symptoms, you start to get congestion. Why is spirulina so effective for allergic rhinitis? According to evidence-based research, there was one study. They gave participants spirulina and a placebo, so something other than spirulina, usually a sugar pill. And they found that those proteins that help your body initiate the immunoglobulin response, it was actually lowered by approximately 32%. So if you don't have the response coming here, you don't have all of those symptoms, like the runny nose, the sneezing, the watery eyes, and the congestion. Another study in Turkey showed that in comparison to someone who took spirulina and the placebo, they then tested their symptoms. So they asked them, how do you feel after taking this? Rather than just testing the blood levels to see if the body is making these immunoglobulins or these proteins to help respond to the foreign invader, they just simply asked the patient, do you feel any better? And the patients actually reported that they felt that they don't have as much sneezing, they don't have as much congestion, and they don't have as much itchiness in their nose. A third study tested 53 participants. There was 23 men, there was 30 women. Both groups were given 2 grams of spirulina per day, and the control group, which was given cetirizine, which is an antihistamine, similar to Benadryl. So one group was given spirulina, the men and the woman, and then the second group was given cetirizine, which is the antihistamine, and they were both observed for approximately 2 months. And they found that the group that was taking the spirulina, they reported better sleeping habits. They were more functional in their daily work activity. Their social activity improved, meaning they were more likely to go out and do things because they were not bothered by all of their allergy symptoms. And then approximately 1 month after the experiment, the group that was taking spirulina, they reported, again, less allergy symptoms, less sneezing, less watery eyes, less running nose, less itchy nose. Not only that, there was another study, so many studies, right, that showed that the spirulina helped the body increase IgA production. So if you go back to my previous lecture on what IgA was, it is again found in the mucus lining. So where your urinary tract is, where your respiratory tract is, where your intestinal tract is, it improved IgA, meaning that it improved its protection in those areas, meaning viruses, bacteria, foreign invaders, they were not able to as easily destroy the lining or the mucus lining of those vital areas in your body. If you're suffering from allergic rhinitis, and because allergic rhinitis runs in the family, perhaps your child is also suffering from allergic rhinitis. It is actually one of the most common chronic disorder for children. So according to data from the International Study for Asthma and Allergies in Children, approximately 14.6% of the population between 13 and 14 suffer from allergic rhinitis. And approximately 8.5% of the population between 6 and 7 have some type of allergy symptoms near their nasal passages and in their eyes. So they're always having itchy nose, watery eye, maybe some runny nose. And they've linked this to seasonal allergic rhinitis, meaning children are more likely to get allergies during specific parts of the year. So if you ask me, is spirulina safe for children? Well, what I can only offer you is some evidence-based study. So they did a study in the Congo. They took 50 children from ages 6 months all the way to 60 months. So 15 of the children took spirulina, approximately 10 grams, along with the local diet, and then 34 children only had the local diet. They noticed that the children that had the local diet and the spirulina, they had improved weight gain, their blood levels improved, meaning maybe they were slightly anemic, and their nutritional status improved. Also, one other study in Cambodia, they took a total of 179 children. They gave the children spirulina approximately 2 grams per day, and at the end of 5 weeks, they also showed that it helped improve their weight gain, and it helped with their anemia, meaning their blood levels improved. And like I had said earlier, spirulina, it is high in mineral content, especially iron. So this may be the contributing factors to why these children have better blood levels after taking spirulina. It's also been well studied that any type of nutritional deficiency can have a large effect on your immune system. So in other words, if your nutrient balance is off-centered, your body is not going to protect you like it should. So it'll give you problems like the allergic rhinitis or any type of allergy symptoms. And if it gets worse over time, you'll end up having other infections. You'll get sick often, or you'll end up developing cancer because your body cannot protect itself from these foreign invaders. So here today, I presented to you all of the beneficial aspects of spirulina. I gave you the most up-to-date evidence-based research. And overall, I think that spirulina is a great addition to your health, including your family's. If you think this blue-green algae or this supplement is beneficial to you, please talk to your primary care provider about adding it to your list of to-dos. Well, I hope today's information was helpful to you, and I hope you enjoyed my presentation. Please click the subscribe button to join me on this adventure for more west to east complementary and alternative therapies. Thank you very much for your patience today. Bye!